November is National Diabetes Month, and all new this hour, we're talking about management and prevention with Dr. T. It's 8:05 here on your Monday morning. November is National Diabetes Month, the time to build awareness in an effort to improve the lives of people with diabetes and prevent it in those at risk. Globally, rates have nearly doubled in adults since 1980, and more than half of the almost 830 million people living with diabetes are women, who are more likely to experience other health risks because of the disease. So Dr. Thompson is here this morning to talk more with us about managing these risks and the challenges that people face who live with diabetes. Good morning. Thank you for coming in. We know this is so important. Why do we need to really raise awareness about this topic?
Well, diabetes is such a common disease, and pretty much everybody is at risk for it. If you talk to anybody, they're going to tell you there's someone in their family who has diabetes. And importantly, diabetes can be preventable with simple lifestyle changes. So it's such an important disease because the consequences are severe, but it's preventable.
Absolutely. What are some of those things that people can do every day, whether small or large, to build up their bodies and make sure that they are trying to prevent this disease?
I know I feel hesitant to tell Arizona this yet again, but exercise, exercise. Our bodies really are built to move, and so we should be moving 4 to 8 miles most days of the week. That's about 30 minutes of exercise most days. And then how we eat. So vegetables. I sound like someone's mom. That advice that our moms give us is absolutely correct. So eating well, eating lots of veggies, cutting back on the carbohydrates, which we love, and exercise are simple ways to keep your body healthy and help avoid this disease.
You know, it's important. We feel like a broken record sometimes, but we know mom's always right with that advice. What are some of those key risk factors that people might not be aware of that could mean that they're more prone to developing diabetes?
Well, definitely family history is one. Most of us have that. For women, if you had diabetes when you were pregnant, that is a risk factor as well. Age is a risk factor as we get older. Higher weight is a risk factor. So we definitely want to look out for those things. And if we know those things exist in our families or in ourselves, that history that I talked about in pregnancy, then you want to make sure that you're exercising, eating well, and importantly, screening for diabetes at least every year.
And what does that screening process look like?
It's a blood test.
Okay,
simple blood
very
test.
easy. So we know it's important for both men and women, but women here are affected by this disease as well. Why do women really need to take it seriously?
So I mentioned that pregnancy is a risk. You can have gestational diabetes, diabetes when you're pregnant, but also diabetes in pregnancy can cause additional risks. And since women are the only ones who do that, we need to pay special attention. Women also have higher risk of heart disease when they have diabetes, and so they want to make sure that if you have diabetes, you're really talking to your providers about getting the accurate monitoring, keeping your blood sugars under control. And then there are things that only women will get, like more yeast infections, right? Men don't get those at all. And so those might be a sign for a woman that her blood sugars are out of control if she has diabetes. So there are particular things that women need to pay attention to that might not be so relevant for men.
If there are people watching at home who are maybe concerned or worried, what is your best advice and what do you recommend people do?
One, you want to get screened because there's we have a classification called pre-diabetes where your blood sugars are a little bit elevated, not quite yet diabetes. Most people who have that don't know they have it. So you definitely want to get screened. Go to your annual exams and make sure you ask your doctor to get that test to screen for diabetes. And all of us have the capacity to increase our exercise and eat well.
Okay, I'm gonna think of you today when I don't want to go to the gym. I'm gonna say, Dr. T said go to the gym and eat those veggies. Yes. And lastly, where can people get in contact with you if they want to get more information?
I'm at Central Phoenix OBGYN, and our website is the same name.
Always appreciate you coming in, Dr. T.
Thanks for covering
so
this.
much.
Stay well, Arizona.